Mr. Young is recognized for 5 minutes.
Madam Secretary, thanks so much for being here today, and thank you for your service. Today you've assured this committee that the exchanges will be up and running pursuant to the Affordable Care Act on time and functional October 1st of this year. Encouraging to hear because it is in fact the law. I do know there's a lot of anxieties. I visit with my constituents and other stakeholders about this matter. There's also some anxiety with the release of this budget, certainly anxiety that I harbor about the costs of these exchanges and said implementation. The President's budget has HHS spending $1.5 billion on exchange grants in 2013. That's an increase of over $300 million compared to last year's estimates for fiscal year 2013 spending, despite the fact that most states have chosen not to create their own exchanges. The budget also anticipates an additional $2.1 billion in spending on exchange grants in fiscal year 2014. Now, through the original law, Congress appropriated $1 billion for implementation, but you, Madam Secretary, were also given unlimited authority to fund state exchange grants through 2015. Now, press reports say there's about $235 million left in the law's original implementation fund. Can you confirm that number or tell us how much the Department has spent on the exchanges so far, and from what other funding sources these expenses are being funded?
Well, sir, I think that if I heard correctly, there were a lot of numbers in your question. You've conveyed a fairly accurate picture. When this bill was passed in 2010, the Congressional Budget Office estimate was a $10 billion administrative cost to full implementation of the law. And you are correct. In the law itself, there was $1 billion appropriated, a tenth of what the nonpartisan CBO recommended be the cost. I think we have done an extraordinary job, frankly, here in 2013, allocating and using judiciously the $1 billion that we had. We do have about $230 million of those dollars left. We will use those and some additional resources in 2013, and we have asked for additionally $1.5 billion in 2014, and that's really to get the IT hub, the call center, the IT up and running, and have...
I'm aware of the significant logistical and information technology challenges of this. Some would say that the design of the project may have been too ambitious, but nonetheless, certainly sensitive to that and all the good people who are working on such implementation.
Well, and I think the good news is we're well under what the budget estimates were.
But $1 billion was originally, that was authorized in the original law. That's what Congress provided. That's what it was said was required by this body when it passed the Affordable Care Act. But we have a doubling of the projection for setting up the exchanges by Congress, and this is with less than half, I want to emphasize, with less than half the states participating. And so I guess, you know, I have a concern that if more states did participate, that would cause the cost to explode even further. Is that your estimation?
No, sir. And in fact, I think that characterization is a little bit misleading. We have right now 31 states and the District of Columbia running all or part of the up-and-coming marketplaces. So the two-thirds of the state are actually engaged. Some of them are not running the entire program. They're running the plan management part or consumer outreach or both, or they're running the entire thing. In the remaining states, we will be setting up the entire exchange as a start, but we are actually in conversations with lots of states who said we would really, once this gets up and running, we see ourselves taking it over.
Thank you. Finally, if you don't receive the additional funding requested, is this going to preclude the ability to launch the exchanges on time? And if not, what is your contingency plans? Presumably there is one.
Well, we are confident that we will launch the exchanges. We will be open for open enrollment October 1st. The hub is basically built and paid for, and we'll be using the remaining resources that we have. We are using every opportunity we have to look at my transfer authority within HHS and the dollars that we have. But you're absolutely right. We have a law that is the law of the land. The Supreme Court has confirmed its constitutionality. There are millions of Americans looking forward to the benefits, and we have requested additional resources to make sure that we can
Thanks so
fully
much.
reach out to folks who need it.
I yield back.
All right, time is expired.